uh, on primary care. And we will start with the Sandhya, first of all. Welcome, everybody. So, Usha ji, आप करेंगे ओम भूर्भुवः स्वः, then I can do the rest. Ush, hello, Usha, unmute yourself.
कैसे आप? So Monica is ready for it.
Yeah, she will try, sure.
She'll try. Well, that's the best we can do,
Yeah,
last minute mein.
yeah.
That's what, because it's difficult to get anybody on the last minute, na?
Yeah,
So
yeah,
at
because
least we
this
have
is a
there.
revision month, but it would be good if we had somebody speaking.
Yeah, because they were the ones, so they should have arranged for somebody because they knew that she's gone, so they should have arranged because they wanted to do it.
अच्छा उषा जी ਤੁਸੀਂ ਸਟਾर्ट ਕਰ ਦੇ ਗਾਇਤਰੀ ਮੰਤਰ
Yeah,
अच्छा, सारे आ गए?
yes.
ਦੇਖ ਲਓ ਤੁਸੀਂ
Yeah, I think we had a
Yeah, I
good
think
yeah,
everybody's here.
कितने पंच बारी बोले, right?
tin pay.
तीन पांच
Three
मिनट
times.
फाइन
पंच बारी? Okay. ॐ भूर्भुवः स्वः तत्सवितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो न प्रचोदयात् ॐ भूर्भुवः स्वः तत्सवितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो न प्रचोदयात् ॐ भूर्भुवः स्वः तत्सवितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो न प्रचोदयात् ॐ भूर्भुवः स्वः तत्सवितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो न प्रचोदयात् Om Shanti Shanti Om. And Raniki, you can take over now.
ॐ शन्नो देवीर्भिष्टे आपो भवन्तु पीतयेशयोरभिस्रवन्तु न ॐ वाक् वाक् ॐ प्राण प्राण ॐ चक्षु चक्षु ॐ श्रोतं श्रोतं ॐ नाभिः ॐ हृदयम् ॐ कण्ठः ॐ शिरः ॐ बाहुभ्यां यशो बलम् ॐ करतलकरपृष्ठे ॐ भू पुनातु शिरसि ॐ भुवा पुनातु नेत्रयो ॐ स्वाहा पुनातु कण्ठे ॐ महा पुनातु हृदये ॐ जना पुनातु नाभ्याम् ॐ तपा पुनातु पादयो ॐ सत्यं पुनातु पुनः शिरसि ॐ खं ब्रह्म पुनातु सर्वत्र ॐ भू ॐ भुवा ॐ स्वः ॐ महा ॐ जना ॐ तपा ॐ सत्यम् ॐ ऋतं च सत्यं चाभिधातपसोधया जायत ततो रावय जायत तथा समुद्रो अर्वणः ॐ समुद्रादर्णवादधि संवत्सरो अजायत अहोरात्राणि विदधाद विश्वस्य मिषतो वशी ॐ सूर्याचन्द्रमसो धाता यथा पूर्वं कल्पयत् दिवं च पृथिवीं चन्तरिक्षमथो स्वाहा ॐ प्राची दिग अग्निरधिपतिर्सितो रक्षितादित्या ईश्वः तेभ्यो नमोऽधिपतिभ्यो नमो रक्षितभ्यो नमः इषुभ्यो नमः एभ्यो अस्तु योऽस्मान् द्वेष्टियं वयं दिस्मतं मस्तं वो जम्बे दद्मः ॐ दक्षिणादिगिन्द्रो पतिस्तिराश्चिराजी रक्षिता पितर ईश्वः तेभ्यो नमोऽधिपतिभ्यो नमो रक्षितृभ्यो नमः ईशुभ्यो नमः एभ्यो अस्तु योऽस्मान् द्वेष्टियं वयं दिश्मस्तं भोजम्बे दद्मः ॐ प्रतीचि दिग्वरुणोऽधिपति पिताकु रक्षितान्मिश्वा तेभ्यो नमोऽधिपतिभ्यो नमो रक्षितभ्यो नमः इषुभ्यो नमः एभ्यो अस्तु यो अस्मान् द्वेष्टि यं वयं दिश्मस्तं भोजं वेदत्मः ॐ उदीचि दिक्सोमोऽधिपति स्वजो रक्षिता शनिर्षुवः तेभ्यो नमो अधिपतिभ्यो नमो रक्षितभ्यो नमः इषुभ्यो नमः एभ्यो अस्तु यो अस्मान् द्वेष्टि यं वयं दिश्मस्तं भोजं वेदत्मः ॐ ध्रुवा विष्णु रधिपति कल्माश ग्रीवो रक्षिता विरुद्ध इषुवः तेभ्यो नमोऽधिपतिभ्यो नमो रक्षितभ्यो नमः इषुभ्यो नमः एभ्यो अस्तु यो अस्मान् द्वेष्टि यं वयं दिश्मस्तं भोजं वेदत्मः ॐ ऊर्ध्वा बृहस्पतिरधिपति शिवो रक्षिता वशमिश्वा तेभ्यो नमोऽधिपतिभ्यो नमो रक्षितभ्यो नमः इषुभ्यो नमः एभ्यो अस्तु यो अस्मान् द्वेष्टि यं वयं दिश्मस्तं भोजं वेदत्मः ॐ उदयं तं सस्परिस्वः पश्यन्त उत्तरं देवं देवत्रा सूर्यमग्नं ज्योतिरुत्तमम् ॐ
इसको जानता है?
उदुत्यं जात वेदसं देवं वह्यन्त केतन
आके देखना तो पता लगे।
श्री विश्वाय सूर्यम् ॐ चित्रं देवानां गादनीकं चक्षुर्मित्रस्य वरुणस्याग्ने आप्राधावा पृथिवी अन्तरिक्षं सूर्य आत्मा जगत्स्थुष्ट स्वाहा ॐ तत्चक्षुर्देवता
अब हो
शुक्रमुच्यते
गया। हमारी आवाज आ रही होगी।
Please mute yourself. Pashem Sharada Shatam Jeevem Sharada Shatam Rinuyam Sharada Shatam Prabhavam Sharada Shatmadinam Swam Sharada Shatam Bhuyascha Sharada Shatat Om Bhurbhava Svaha Swaha Tatsaviturvareniyam Bhargo Devasya Dhimahi Diyo yo na prachodayat हे ईश्वर दया निधे भवत कृपया नेन जपोपासनादि कर्मणा धर्मार्थ काम मोक्षाणाम सिद्धि भर्वेन ओम नमः शंभवाय च मयो भवाय च नमः शंकराय च मयस्कराय च नमः शिवाय च शिवतराय च ओम शांति 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 Okay, I will give it to Monica. She also happens to be my daughter, so she'll go ahead, Monica.
Pretty sure everybody knows that already.
Everybody.
Hello, everybody. So I'm Monica Sharma. I'm a family medicine physician, and just a couple of disclaimers about today. My computer is not working very well. I'm not able to use the audio on there, so I'm using my phone. So I'm not going to be able to see if somebody is raising their hand or trying to speak or anything. So Mom, I'm going to need your help to just kind of let this flow a little bit if anybody has a question, okay? So our topic for tonight is going to be an informal Q&A, a question and answer session with your favorite primary care doc. I'm going to ask the other doctors in the group tonight to kind of assist a little bit. I've been answering questions all day at work, so I'm going to do my best to keep that energy going. And this is going to be a general kind of, very informal, very, feel free to ask anything. There's no question that I haven't heard before. There's nothing that's going to be embarrassing or silly or anything like that. Just really try to feel as comfortable as you can tonight. For reference, I'm going to be using the American Academy of Family Physicians. They have, it's an academy that I am certified with. I use their articles, their journals to keep myself abreast of any recommendation changes or clinical guidelines that might be coming forth. And they also have a patient-oriented website called familydoctor.org, which is wonderful. Lots of great resources for yourselves, for your families, for your friends. You know, really just try to utilize this. It's free of charge, and it really does cover a wide array of different topics. So that's basically what I'm going to be using tonight to kind of back me up a little bit. So
that is American Academy of Physicians. What
so
is
the
it?
American Academy of Family Physicians is the association that I use, but the patient-oriented website is familydoctor.org. Okay.
Thank you.
Oh, sure, no problem.
If anybody has question, they can raise their hand, and then I will let Monica know.
So you can throw questions into the chat also if you want to keep it anonymous.
Yeah.
That's fine, no problem. So just a little bit about my practice. So I practice outpatient medicine. I'm part of a private practice group. We have offices in Westchester, in the Bronx, and in Queens. And right now I'm seeing mostly adult patients. So anybody about 17, and I think 17 is my youngest patient right now, on up to 105. So it's a lot of fun. And we mostly do a lot of chronic care management. So lots of, blood pressure issues, lots of diabetes, lots of cancer and prevention screening, which I talked about in my first night with you guys. And a lot of, fun women's health topics also, which is kind of my area of interest. And every now and then I will start asking about people's kids too. So even though I'm not seeing kids in the office, we still do a little bit of pediatric care as well, informally. So any questions? We can get this going.
Yeah, Monica, I think in the interest of our group, especially for the females, if you can just highlight very quickly, when should they start, having the pap smears and the GYN checkups, and so on and so forth.
Absolutely. So GYN care is extremely important. I know several of my patients, a lot of my South Asian patients really do, I don't know if there's some shyness or some embarrassment there, but it is important to make sure that you keep up with your GYN care. So we'll start with breast cancer screening. So mammography right now is starting at age 40 with biennial mammograms and or ultrasounds. And then starting at age 50, those will switch to an annual exam. And then as far as GYN care, so pelvic exams and pap smears. So just to kind of clarify, the pap smear is a part of the pelvic exam. Okay, it's not, the pelvic exam is not just the pap smear. The pap smear is a very specific test where the gynecologist will do a scraping of the cervix, pick up some cells, and those will be sent off to look under the microscope to see if there are any changes or dysplasia with the cells themselves, and also look for human papillomavirus, okay, HPV, which is a type of virus that can cause cervical cancer. So that test starts at age 21. All right, there was a recent, no, not too recent, maybe in the last 10 or 15 years, there was a guideline change for the age when to start cervical cancer screening. Now, across the board, no questions asked, we start at age 21. Between the ages of 20, yes.
Yeah. Are they still using the cervical vaccines? For cervical?
Absolutely. The Gardasil vaccine is still very, very, I recently saw some young patients in my office. The guideline for the vaccine used to be up to age 26. Now it's been extended up to age 45. So if there's anybody here who's young enough who hasn't gotten the Gardasil vaccine, please do. We're very excited. It's a vaccine against a virus that causes cancer. It covers several different strains of HPV. including those that are high risk for cervical cancer and those that can cause genital warts. Where'd you go? Okay. And then just as far as the pap smear itself, so starting at age 21, and that goes up until age 65. Okay. Depending on the type of screening, the intervals might change between 3 and 5 years. If there are abnormalities with the screening test, the gynecologist will go through next steps as far as whether that will be repeated or a biopsy will be done or any other kind of investigation. But generally, we do like to continue those through age 65 unless there's an issue. Usually at 65, we can stop.
Poonamji has one question. She has.
Yes.
Yes. My question is about the pap smear. Does it
Okay.
have anything to do with the person being sexually active?
So
The person is not
we
sexually active.
right.
What
So
is-
right. So if someone has
no
not
history.
right, if someone is sexually naive, they haven't started sexual activity by the time they're 21. From when I first started school, we would start pap smears after the onset of sexual activity, but now they've changed the guideline to include even if you're naive, you start at age 21.
What about the older people? I'm not talking about the naive, I'm talking the elderly.
If
At
there
what
is
age to stop,
no
and there has been no sexual activity. It was a
So right, so regardless of whether or not someone is active, we still continue screening until age 65, because that virus can stick around for decades without causing a problem, and then if it is picked up, it needs to be dealt with.
So if a person is over 65, there is no need for the pap smear.
As a screening test, no, they don't need a pap
Yeah,
smear.
as a screening
If-
test.
Exactly. If there are symptoms, if there's a history of an abnormality with the pap smear, then the guidelines, are adjusted accordingly. We do like to make sure that there's at least a 20-year history of normal negative pap smears before we decide to stop. But usually that's at 65.
Because that's what the thing was, my question was, if there's no history, no sexual activity, no symptoms, where's the need for the screening? That's what my question
It
was.
can come up de novo. HPV is not the only thing that can cause cervical cancer. It's not just a sexually transmitted kind of thing.
No, I'm not talking about this. I do understand
Yeah.
all
Yeah.
this.
But just so everyone is aware. Yeah.
Okay. Thank
Okay.
you.
There is a question in chat. I will read it to you, Monica.
Okay.
From Geeta. Is it Geeta? We have. I have very hectic sleep pattern.
Okay.
Go to sleep at 10, but by 12 I wake up and I can't go back to sleep. Sounds like me.
Sounds like a lot of people.
I go to living room and go to the living room and watch TV. I have tried YouTube videos to go back to sleep. Sometimes nothing works. I also sometimes have nightmares and I scream and I have to wake up. I'm
Okay.
57-year-old and is there something there?
Okay.
I think it's a common problem.
It's a very common thing. And originally my talk was going to be on insomnia, but unfortunately with this being a last minute thing, I wasn't able to get it together on time. So I apologize for that. Sleep hygiene and sleep disorders are a very, important thing to talk about. Sleep is important, right? We spend a third of our lives asleep. We're supposed to spend a third of our lives asleep. It's when our brain gets a chance to reset. It's when our cells have a chance to repair or replace. And it's a chance for us to also kind of step back from our busy lives, take a few hours for ourselves and get ready for the next day. If we're not getting quality sleep, it affects everything, okay? It affects your mood, it affects your blood pressure, it can affect your sugar, it can affect your performance, it can affect your concentration. Everything is affected by your sleep. So if you're not getting good sleep, a lot of times when my patients come up to me with those kinds of concerns, we talk a lot about sleep hygiene, okay? So there are a few things that are important to keep in mind. Number one, screens are horrible. Screens are very, very bad when it comes to trying to get yourself into that sleep mindset. All right. So I do try to counsel my patients that for at least an hour before you're planning on going to bed, turn off all screens. Stay away from computers, stay away from the television, stay away from your phone. Really just avoid having that artificial light bombarding your eyes, okay? And another thing that's important about sleep hygiene is you want to try to have the same routine every night. Now, with kids, sometimes it's not that easy. With busy lifestyles, different schedules, things going on, I get it, it's not easy. But as close as you can get to a routine, the more chance you'll have a quality night's sleep. All right. So an hour before bedtime, or actually before we even do that, set your bedtime. Okay. So try to set your bedtime every night to be around the same time and prepare yourself for it. Prepare your brain for it. Get everything done that you need to get done. Turn off the screens. Whatever your nightly ablution, the ritual might be, get that done. And before bed, you can read, you can meditate. I recently got a Peloton, and I know on the Peloton app, they have meditations on there. And I've gotten my kids to start doing this too, which is fantastic. 5 minutes into this meditation and you're zonked out without even hearing the end of it. Or even if you're not able to meditate, formally, you can always just do some deep breathing exercises, turn out the lights, maybe some soft music if you want to, but getting into that zone where your body is prepared for sleep. Okay. A few things that happen if you're not getting good sleep is you can start napping during the day. You can start feeling tired and over caffeinating during the day. You want to try to cut any caffeine out in the afternoon if you can, if you're having trouble sleeping. So for me personally, if I have anything after 2 o'clock in the afternoon, I know that it's going to affect my sleep. So stopping,
Yeah, no caffeine. That's what.
Yeah. So the caffeine, a lot of people are very sensitive to it, and it can really affect the quality of their sleep. So trying to cut that out, early afternoon would be good. Making sure you're well hydrated during the day will also help reduce the chances of you waking up during the night. Avoiding heavy meals before bed is also an important thing. A lot of times, having a heavy meal and having that sit in your stomach can affect how well you're able to fall asleep. So keeping it nice and light, stopping eating, at least a couple of hours, 2-3 hours before you're going to go to sleep, also very important to help you digest. Let's see, what else? Those are mostly the sleep hygiene kinds of topics that we can talk about.
Reading the book helps too.
Right. So reading. So anything, again, that's not going to fully engage your brain. I mean, don't start turning on the news. Don't start reading a newspaper even, because that can bring about some anxiety, bring about some other racing thoughts, and your brain goes all different places. So trying to get yourself into a more calm kind of setting would be best. So if you're not getting good quality sleep, if you're over caffeinating during the day, or if you're napping during the day, that can also affect your sleep. So if you've got into the habit of making up your sleep during the day, you've got to break it. Okay. It's going to suck. It's going to be very, very difficult to do, and it's going to be very uncomfortable. And it will take time. It might take a week or two to really get out of that cycle of napping during the day. But as much as you can to push your sleep to that 7-8 hours at night, do your best to do that. If you're getting up in the middle of the night, try not to turn whatever sleep you did get into just a nap. If you're only sleeping for 2 hours and then you get up, start watching television, start going on your phone, then your brain kind of goes into a nap mode instead of a sleep mode. And that's going to affect the quality of your sleep, make you more tired the next day. So try to power through. Even if you're laying there and you're not able to fall asleep right away, do those things that we talked about. Maybe some soft music, maybe a little bit of reading, maybe no bright lights or anything, but to a point where you're still trying to get into that sleep mode. I hope that answers some of the questions.
Breathing exercises also help. If you wake up in the middle of the night, just concentrate on your breathing, and that can put you to sleep.
It will bore you enough.
Yeah.
And the last thing is there are lots of sleep aids on the market. There are tons. Patients ask me for them all the time. Some of them are effective, some of them not so effective, and a lot of them are very habit forming. Okay, so as much as possible, really work on sleep hygiene and work on trying to improve the quality of your sleep without those prescription or non-prescription sleep aids before talking to your doctor about medication. Because I have patients now who are not able to sleep without that Ambien, and it's very difficult to take them off of it after they've been on it for weeks, months, even years. Okay.
Yeah, I was going to say, yeah, I sometimes this herbal teas, chamomile tea helps. I tried those and it does help me.
So I do like those in the beginning of the night. I don't like
Yeah,
them later
before,
on.
yeah, before
Right.
sleeping.
Right.
I know the same person is asking Monica that is it, I'm afraid it is the beginning of Alzheimer's, which I don't think so, but you can comment on that. But
The sleep problems, you mean?
yeah, it cannot be Alzheimer's because
Yeah,
Alzheimer's,
I don't think there's really a correlation there. I,
Alzheimer's is basically
I
memory, if you
yeah,
have,
it's more cognition, it's
Forgetfulness.
more right, exactly. It's not so much. So sleep is kind of a separate thing where yeah, I don't think there's a correlation there.
But
I really
Monica,
don't.
I
I
think
don't
those
think so.
people, the people
Yeah,
who think it's Alzheimer's, the
yeah,
best remedy, stay off the Google,
yeah.
because the more
Absolutely.
I think you self-diagnose, the more you. I felt that when I was doing my nursing. In
Uh-huh.
college, every disease that I studied for the next 1 week, I thought I was suffering from that.
Oh yeah, no, the same thing
Right.
happened in medical school. It happens to everybody. It happens all the time.
I
You're
had to tell
studying
my
it, you
daughter the
suddenly
same thing.
you
Because she was
manifest the
with her
symptoms
first
and
pregnancy, she used to come up with everything,
yeah,
including if you fly with the newborn baby, the baby dies. I said, then walk to wherever you are going. I
yeah,
said, I said, where did you find it? And everything she found on the internet. I said, you know what?
yeah.
Get your computer disconnected.
Yeah, the internet. So that's why I recommended this site. This site
They
is it's
have
vetted.
no
It's
clue.
yeah,
The people are clueless, the people who are telling, the people who are reading, and then they come up with, and then they will
and
come and
they
tell you,
and they all
oh,
come to my
I have
office.
appendix, remove it. How do you?
Absolutely, absolutely. That's right.
Even this was just one of the funny things.
Yeah. Okay.
Anybody else has any question? Can you comment on the present situation of COVID, Monica?
So, well, today was the first day that the mask mandate was lifted in schools in New York State. I am doing my best to take that as a good sign. I believe that the cases have definitely gone down significantly. I think we were at around, I think at the highest point we were, or one office I was talking to was at around a 50% positivity rate, and now they're down to about 2%, which is very significant. I think that the latest variant that was out, the Omicron, the original one, not the B1, but the original Omicron that came out was a milder kind of disease if you were vaccinated. So that was helping keep people out of the hospital. So that's great, helped to reduce the spread. But we're not totally out of the woods yet. I think it's still important to be vigilant. If you are having any symptoms, if you know anybody who's having any symptoms, make sure that they're still isolating or you're still isolating the way that the guidelines say to. I think, I hope that we are turning a corner. I think that we are, knock on wood. And, the summertime traditionally is a lot easier when it comes to viral infections like this. So even with the flu, with cold viruses, and with COVID, the summertime is going to be less of an infectious season. So now that we're kind of coming towards that, numbers I hope will continue to go down to the point. I mean, they're cautioning us against calling this endemic. It's still a pandemic. There are still restrictions on travel. There are still, mask mandates when it comes to air travel and things like that. I still wear a mask if I go anywhere. Medical offices, doctors' offices, and hospitals are still requiring masking. But I really hope this is the beginning of the end. I think we're all done with this. So, yeah. And I'm still trying to promote the vaccination as much as I can with my patients.
Just to add to the COVID situation, I just wanted to tell that today I got a call from one of our oncology people who said that they have a patient who has lymphoma and did get COVID twice. And guess what? The antibodies did not increase.
Right.
So they were really concerned that, this is not a good situation. So they still decided to give convalescent COVID plasma, which is when patients recover from COVID, their plasma it has high level of antibodies. So they plan to give that. However, it has been removed from our shelves in the blood banks and even in the major companies. However, there is one company called America's Blood Banks of America, all the blood banks together, they have one association, and they still continue to keep CCP, what we call, and that is a remedy for people who are immunocompromised, in the sense who have these ailments, cancer cases and others, and they don't make antibodies. So just as a preventive measure, they give this convalescent plasma, which is not given now to regular people.
Right. Thank you.
Also, I think the same person who wrote that sleep deprivation is affecting my memory, which is possible.
So that can happen. That can
yeah.
happen. Yeah, absolutely.
They should still get the test, like memory test done or something if they're.
So first get a good night's sleep and then check and see if the memory is really.
Oh, okay, Shanti, I think you're muted.
Because people with Alzheimer's don't know that they have memory problem. At least
they're not. Yeah, they lack the insight. They really aren't aware.
Other people usually are aware that she's forgetting forgetting things. I mean, normally forgetting, like we sometimes forget where we put the keys or where, those are normal, short-term memory problems. But it's not Alzheimer's, I think.
I know.
Can say.
Yeah. So sleep plays with your brain. Lack of sleep can really affect your cognitive function. It can affect your memory. It can affect your ability to concentrate, to focus. And not getting a good night's sleep is, it leads to decreased productivity. It leads to a lot of different things that can be very scary. So, right, exactly as Rakesh Shanti said, you want to make sure you're getting a good night's sleep before you start going down the memory rabbit hole.
Is there anybody else has any question?
Yeah, Monica, there's been some talk about these exotic oils like lavender and things like that as sleep aids. Can you shed some light on that?
So those aren't, it's not really my area of expertise. I'm just going to kind of just things that I've read in passing. They can be very soothing. Okay. Whether it kind of plays to that whole getting yourself into that sleep mindset thing. If that's what soothes you, then that's great. If that's what helps you get to a full night's sleep, that's great. Nothing has been studied. Nothing has been really, approved or anything. And none of these things are really regulated by the FDA. But if that's what calms you, if that's what soothes you, then go for it. I don't think there's any harm unless you're ingesting the oil. Please don't ingest the oil.
Do foods have any effect on sleep, Monica?
Yeah. So as I was saying before, you want to make sure. This is turning to a sleep talk now, huh? I love it. So you want to make sure that you are not having any heavy meals at night. So really the heaviest meal of the day should be in the middle of the day. Usually breakfast or lunch is the heaviest, usually lunch. And dinner should be lighter, not too spicy. I know that's hard to do. and nothing that's going to sit in your stomach for too long. So foods, lighter dinners, earlier dinners are going to be very helpful and conducive to a better night's sleep. Avoiding caffeine at night. I mean, my husband drinks 2 cups of coffee every night, and he's up at night to show for it. So avoiding caffeine at night will also help reduce those sleep anxiety issues. As far as foods that help, warmer, from what I read, warmer foods are better than cold. Okay. And nothing that's too sugary, nothing that's too sweet. But yeah, that's really all I've read so far. But you want to avoid, the biggest thing is you want to avoid anything too heavy.
So no late night parties.
Late night parties are okay if you're planning on going to sleep at 3 a.m. Somebody's not muted.
Radio on.
Okay. So a couple of other things I just kind of wanted to touch on, and I don't know if there are any other questions, Mom.
I don't see any now.
Okay. So there's one thing I do want to talk about, because I don't know how much this has been discussed with this group. I had a patient today, 74 years old. She's a former office manager for my practice. And it was wonderful to see her. She's a recent widow. Her husband passed away about 3 years ago. And she lives alone. Okay. She has a house, a 4-story house. She has a basement, 2 floors and an attic. She's constantly going up and down the stairs. She otherwise is fairly healthy. Okay. But I had this discussion with her because she's 74 years old and because she lives alone, that it's important to be prepared. Okay. There are a couple of things that we can do to help making living at home alone or living at home as long as possible, as safe as possible. Number one, you want to talk to your doctor about setting up a healthcare proxy. Okay. A healthcare proxy is somebody who can make medical decisions on your behalf should you become unable to. Number two is making it safe for yourself at home. There are lots of agencies and services, visiting nurse services can come and do an assessment in your home and decide, what things might help, whether it's a grab bar in the shower, whether it's a chairlift up and down the stairs, whether it's, anything that might pose a fall risk, keeping things out of the way, any assistive devices to help you get around your home. Those would be great. And the last thing is something along the lines of a life alert. Everyone carries their cell phone right now. That's great. But if you get into a situation where you get hurt, you're by yourself, your phone is on the table, 30 feet away, you can't get it, getting a life alert, which is a little button that you can wear around your neck on a small string, can get you in touch with emergency services very, very quickly if that's needed.
How can somebody get that?
Google. Yeah, I can actually look up the number for you right now. Give me 1 second.
Okay.
Yeah, medical alert.
Is it easily available if anybody wants it?
Absolutely, it's available. I believe it's covered also. There are several different medical alert systems that are available. Amazon has some that are available also. You want to make sure that you have one that will connect to your local emergency services. That's the big thing.
Is it like a phone or something, or it's?
No, I wish I could show you this, but my computer, like I said, is not working. Yeah. It's a button. So it's, you would just wear a necklace around your neck on a string. It's a small, it's almost like the face of a watch.
Okay.
It's very small and it just has a button and that's all. It's very, very simple. Anything happens, you push the button. That's it.
Yeah, like the commercial, they say I'm fallen and I can't get up.
Exactly. Yeah, I fall and I can't get up. Yeah. So as the population starts to age and as people are more are aging healthy, want to live in their own homes as long as possible, avoid going into assisted living and going into senior living or a nursing home. That's great, but you want to make sure that you're prepared for that. And that's a good way to get that going. Even if nothing happens ever, which I hope nothing ever happens, it's good to be prepared.
And they can talk to their primary care doctors about those.
Exactly.
like
Yeah.
getting into those things, like
Yeah.
signing
So that just popped
papers,
into my head. I just wanted to make sure I said that before we finish.
proxy, and those advanced directives, basically.
Exactly.
So you said one thing is to have a health proxy. One is
Healthcare
this,
proxy.
yeah. Then this.
Another is doing an assessment of the home to make sure it's as safe as possible.
Okay.
And like I said, visiting nurse services is one agency in Westchester that is able to come into the house and do that assessment for you. They just need an order from your doctor to do that. And then this medical alert.
Very good.
And on the proxy, they also write that, if we suppose the person gets into a situation that can't make their own decision, that they can appoint somebody, a relative, daughter or a son, to make decision for them at that time, when they can't make their decision. So that's part of the proxy, and also.
And it's important to talk to whoever you appoint about what your wishes are.
Yes.
God forbid something
What
happens.
all you want to get done and what all you don't want to get done.
Exactly.
Right.
Monica, do you follow the Polst method? Like people who make the will and they go to different parts of the world. So I believe there is something called Polst. I really don't know what it stands for.
Yes.
Somebody gave us a talk, and he said that it's like honored in any part of the world you go, they will honor
Oh, really?
it. Yeah.
Yeah, that's
Oh, I haven't heard about
permanent
that.
order for
Yeah,
life.
there is somebody. Yeah, there is something like that too.
Yes, it's called
Okay.
the permanent order for life-saving treatments. It's always on a shocking pink, like a cardboard sort of a shield.
Okay.
And it's supposed to be displayed on your refrigerator.
I see. Okay.
Because
Oh, I'm looking at it
I
right
worked
now.
in home care for about 6 years.
Okay.
So that's how I know. But Polls has been around for a very long time, but I've
Okay.
actually dealt with it, helped people get it. And every time we go into a place, we have to make sure that's a part of our admission
It's
process.
displayed.
It's
Okay.
a part of our admission process that the Polls should be there. It is
Okay.
there or not there.
Okay.
Because if you have a post, you're not supposed to call 911.
Right.
Because
Okay.
when you call 911, they'll look for the post and they'll say, we are going.
Okay.
That is a permanent order and you don't need a reorder for it.
So it's different from a DNR.
It's a different, post has to include a DNR.
I think
Okay.
everything is included in that.
No,
I
post
see.
has to include a DNR because
They do it in
they're
the
saying that you do not want.
We
to-
do in the assisted living. We have that, but I haven't done that in anybody for their
Yeah.
home.
No, because I used to see it in people's, I had only heard about it, but I have seen it for the past 6 years in a lot of people's houses. Some of
Okay.
them were elderly, others were just with terminal illnesses. So I just wanted to share this.
Anything
you.
else, Monica? We need to.
If there are any other questions, I would love to answer anything else. But I think that was an important topic. I
have a
know
question,
it wasn't
if you
planned.
don't
But
mind.
yeah,
Monica,
absolutely.
my question is, would Medicare or Medicaid, all this for senior citizens, would that insurance cover about the emergency alert that we wear on our neck? Would that cover that?
They should. They should. Yeah.
You have to check
You
with
have
your
to
states.
check with your insurance.
Yeah. Check
Just
with the insurance company.
especially
But for the
Medicaid,
most,
check with your state.
yeah, for the most part, from what I've heard, we haven't had any issues getting those approved in New York.
If you don't mind, are you a sleep specialist? I don't know.
Sorry.
Are you a sleep specialist, doctor?
Family medicine. The joke about family medicine is we are jack of all trades,
Oh,
but
yes.
master of none.
Master
So
of
we do everything.
Monica, I would like to share a
Thank you.
time-tested sleep remedy, which I've been using since I was, I think, about 18 years old when you join college and you
Okay.
go into that late night study mode.
Right.
We take the poppy seeds.
Poppy
Just the
seeds.
regular
You
poppy
know what
seed.
poppy seeds are, right?
No, I know. Don't you have them in? Don't you have them in
Okay,
cakes and
just
muffins?
making sure.
No,
Okay.
I know what poppy seeds are.
We never use
I
that.
roast them, powder them, and keep them. And at night, have a teaspoon and half a cup of milk, warm milk, before you sleep. It has
Oh yeah,
actually just
warm milk
recently,
helps. Yeah.
even a 7-year-old
Okay.
hyper child has calmed down, and within 3 days.
So poppy
And just
is
you need 1 to half a teaspoon at night, because it really, we make, I think your mother will tell you, we used to make khaska ka halwa.
हाँ,
okay.
use करते हैं.
Khaska ka halwa.
Yeah. I never used
Okay.
that.
No,
but
because when I was a child, we all were given that in the winter. It soothes your nerves, it calms the brain. In the evening, we were given a little bit, like you have a snack with the milk after when you come from school.
Right.
It was nice and delicious, like a halwa with lots of badam in it. Ek chammach khana hai, and you'll sleep nicely at night.
Okay. So
And
just
the
as a
other thing,
disclaimer,
that helps is massaging the foot soles with oil.
yeah, that's very good. That's also very good.
That's
Thank you for
just a little
remembering.
bit of oil at night
Yeah.
just before you go to bed. Massage your foot soles with that. That really helps.
So I just want to put a disclaimer out there. So poppy, yes, poppy can work. Poppy is also the precursor for opium. So
yeah.
you have to be careful with the medications that you're already on. Okay. You cannot mix this with some medications. Some blood pressure medications really would not like this poppy. Okay, so just really be careful about that. Yes, it will put you to sleep. Yes, it will relax you, but it is basically opium. So I just want to put that disclaimer out there before everybody runs for the poppy.
Actually, warm milk just by itself helps.
By itself, yes.
Yeah.
Thank you very much, because I totally overlooked that, since I'm not on any medication, so I overlooked that part of the
Yeah,
opioids.
so just to put that out there.
Right?
Especially when they're going for toxicology studies.
No, that doesn't.
It will
No. I have personally had toxicology by drug testing.
Yeah.
Just during the week when I was having poppy seeds ka masale wala khana every single day. And I was like, oh my God, I'm going today, but I don't want to delay it. Let's see what happens.
Right.
And nothing happened.
Okay.
I think
All
not
right,
every poppy seed, every variety has that opioid thing.
Right.
Those
Yeah,
are
and so
poppies.
I didn't learn this in medical school. You know what taught me about the poppies?
No, all the poppies do not. All the poppies.
No, I know, but I just want to make a joke and a funny story though.
Yeah, I know.
So the
Fire
thing that taught me about the poppies was the Wizard of Oz. I don't know if you guys remember the movie or the book, The Wizard of Oz. But Dorothy, while she's trying to find Emerald City, she lays down in a field of poppies and passes out, falls asleep right away. And that's what taught me about poppies.
They can be addicting too.
Yes, very much.
When I was eating the poppies,
and very soon, and very soon it.
People use it. I don't know. They use it in the dishes, like curries.
That's how you use it,
Yeah, I never use it, but
I use it all the time. It's there.
तो उसको thick curry को thick करने के लिए भी use
करने के लिए मसाले के लिए, for a lot of Mughlai curries.
Yeah.
We use that even for my pala during Navratri. I use it.
Oh, okay.
It's not that you're using
Abhishek, have any question?
Anybody else has?
Yeah, what is poppy? I don't know what is poppy.
So poppy, it's a flower. It's a type of flower, and there's a variety.
Khaskhas.
Oh.
Posto.
Khaskhas?
In Bengal, it's called
khaskhas bolte hain usko.
It's not isabagol, right?
No. It's called either khaskhas in Punjabi or khaskhas in Hindi.
Okay.
And post in other languages.
You guys had me Googling poppy seeds for insomnia, so I appreciate that. But just be careful with that. Just with other medications, just be careful. Okay. Any other questions or comments or anything?
No, that's a good discussion. I think we have Vishnu Abhishek. He had read a book on diet. And Abhishek ji, are you there? I thought
Abhishek, yeah, he's there, but he's
there.
he'll
He
be
had read a book on, food,
oh.
because this is a month of nutrition, and we wanted to have this talk related to food and nutrition and
Nutrition is very
health-wise
important.
in general. And this is good that we are covering different aspects and everybody's thoughts, yeah, this is good. Yeah. You have any questions?
No, I don't.
Yeah.
I just want to say something. Last week, I was listening to one of the seminar of Dr. Doctors from Long Island. I forget Dr. Noori. He's an oncologist, and he was talking about food and diet. He treats cancer patients and all that. And he said that when you're cooking, you should always put the exhaust fan on, because those fumes get into your lungs. And it's in India, it's common because they don't have the exhaust fan. That's why people are having lung cancer. But here we have, he said it's very important because the ladies are always in the kitchen. They should be putting exhaust fan on while you're cooking so the fumes don't get into your lungs. He gave a very good talk about it, and different food. You should always eat high fiber food, he said, all the time, and pulses and make your less fiber. So it was a very good, I taped it, so maybe I can send it to you and you can listen to it. It's a good, he gave a lot of suggestions about it.
Yeah, say
I
what
think
Ma'am,
it's
sorry, this
very
is
good.
Abhishek
Usha ji
Vishnu.
has mentioned that because I never knew that we should put the exhaust fan on. Thank you for letting me know.
Yeah, because that he stressed. He said in India, the breast cancer and lung cancer is on a very rise because they're cooking all the time and they're taking fumes in. They may not smoke, they may not have been near the smoker, but this is what is causing that.
Wow.
yeah,
Yeah.
the oil, I mean,
Good to know.
can't be burnt
Sounds
so much that it
makes
causes the
sense.
fumes or any oil.
So, ma'am, you asked for me. So, yes,
Abhishek is there.
I have a little bit of an interest, more from an academic or research perspective, on Indian diet and how it affects our metabolic health. But there's a lot of background noise here, so I'm trying to get away from kids playing. Nothing to speak today. Maybe on a more dedicated discussion on this topic.
Okay.
Yeah.
Okay. Very good. That's fine.
Hmm.
And Geeta ji, you have any more questions?
No, there are two or three Gitas. No, I don't. But I did
I
miss you
don't.
in the Hanuman Chalisa. I didn't know. I was waiting for you to come.
ये तो गीता अच्छा आपने
Mohini ji?
जी नमस्ते.
Oh, namaste. Where are you hiding?
Moini is there, yeah.
Mohini ji, आपको
Sheila.
अच्छा. We have some people from Chicago. So.
सबके वीडियोस बंद है ना तो पता ही नहीं चलता कहीं
Right.
चलो
So, चलो फिर should we do the Shanti part?
sure.
Monica was very good.
5 minutes if anybody
Acha,
wants to
thank
sing
you.
bhajan or something.
So good to hear to Monica. It was very nice.
Oh,
I'm
namaste.
glad. Thank you.
Ji, namaste.
Thank you for the chance. And I'm sorry it was so last minute, but I hope that this was informative and helpful and fun. It was fun for me. So
Yeah,
thank
yeah.
you.
No, it was
very,
informative.
very good. Thank you.
Yeah.
Mhm.
So good to see you, Benji and
we do,
Faisal.
we do this once a month, so everybody should come, whoever
Yeah.
wants to.
Right. So Shanti
शांति पाठ कर लें अच्छा
हाँ जी।
ओम दौ
शांति
शांति
अंतरिक्षं शांति पृथ्वी शांति शांतिरोषधय शांति वनस्पतय शांतिर्विश्वे देव शांति ब्रह्म शांति सर्वगुण शांति शांतिरेव Shanti Rama Shanti Redi. Om Shanti Shanti Shanti.
Thank you,
Sabko
Monica.
Thank you.
namaste.
Everybody for
Namaste.
joining us.